Tamam mıyız? So we have sensational injuries like that. To come up with a definition, head traumas in sports could be during the training or the competition itself, could be direct or indirect, and it covers any tissue in the head. So they could be simple cuts or contusions, or it could create like skull fractures and aneurysm. Some sports are riskier from that point. When we say team sports, rugby, American football, and ice hockey, they have a lot of head trauma in these sports. And in individual sports, wrestling, boxing, or MMA, a lot and repetitive hits are sustained in the head in these sports. About 98% of the injuries happen through direct hit to the head, and indirect ones are mostly head-to-head struggle. And the direct ones, like by 80%, they come from hitting the opposition. Sometimes, in ice hockey, they also hit the wall by the side of the pitch. So 85% is mostly done through the contact with the opponent player. So which group is riskier regarding the head injuries? I mean, can we have predictions? Yes, literature provides useful information. If we have repetitive hits on the head in the relevant sports, it is riskier. In athleticism, for example, the athletes are going to be less likely to have head injuries. Women exhibit about 2 times more risk in general because of 4 or 5 different factor and mechanism. They're riskier. Young age, because of some behavioral patterns, young age is also a risk factor, and the competition is like 8-10 times riskier than the training. Position, like for example a striker in football, is also riskier. And if there is a history of concussion, it is also regarded as a risk factor. Let's say there is a head injury, and team doctors are going to be speaking after me, by the way. They're going to expand on that. So what kind of clinic do we have? Let me show you some examples. The first ones are from MMA. So there is an abrasion under the eye and hematoma. And in the bone tissue, there could be a problem as well. So it is highly likely that we face an injury like that. This one has concussion after that and knocks out. And this one has a significant contusion, maybe a problem in the frontal bone. And there's a lot of things here. We have abrasions, contusions, and there is a very significant nose fracture, and we have mandibular break here, fracture here. So head injuries could cover almost every tissue in the head. So when there is a contact to the head, it's less than clear what we are going to face. This is why we prioritize it. It doesn't have to be that bad all the time. This is an injury that we evaluated in the pitch. It was a simple injury. But for 3 minutes, we couldn't stop the bleeding. So that was a shoe hit on the nose. Afterwards, this is the photo that we took. And the bone was intact. But in a head injury in the pitch, you have 3 minutes to evaluate. So the referee does not kick you out for 3 minutes. some referees even give you longer. So this was a simple injury, but we couldn't stop the bleeding in 3 minutes. We used bleeding stopping sprays, and the player was sweating a lot, and we couldn't basically use stickers. So simple traumas or head injuries sometimes could be different to manage as well. So the concussion here is very important. Despite the lack of a structural problem on the brain, via different mechanism, it is characterized with loss of function. I'm going to show you a few videos now. All of the players in this video are identified with concussion. To the goalkeeper. Goalkeeper takes the hit here. This is from the German league from 2022. Look into the face. He's holding his jaw in a tight way. And there is a mini whiplash when he's down, and a lot of that is related to concussion. So an injury like that is a very, the goalkeeper is not conscious here. And check the left arm. The left arm stays as a fist. This is not a direct finding, but it makes us concerned. They don't see the opponent. And with the whiplash, there is a muscular movement as well. So he hits the ground real fast. These are, of course, unwanted situations, but this was a relatively clean injury. And here we have another head trauma. We will have 2 concussions. They're immobile on the ground. The goalkeeper looks a little bit worse, but we wouldn't know that without clinic. The players, their first reaction is important. It gives us an idea about how bad the situation is. The referees normally call the doctors before they see the players. There's a similar pattern here. We're going to have some other angles as well. The goalkeeper is going to fall on his face. He has no control, no protection mechanism, and this basically makes us think that he could be unconscious. The goalkeeper hits the ground with his head. So we have impact scissor, and they're both diagnosed with concussion. This is from the last World Cup. FIFA reported that as a concussion as well. Follow the defense player here. See this one here? And here we have Messi. And look at the reaction of the goalkeeper. The player is on the ground, and the goalkeeper's knee is on the jaw of the player. Look into the reaction of the goalkeeper. Let's see it from up close. A lot of players here. There is a clear hit to the jaw. He hits the ground with the head. See? This is one of the bad injuries. And this is one of the concussions that we responded, by the way. See, the head of the player hits the body of the other one. I intervened this one in the pitch. When we got into the pitch, the player was not able to speak, and he had empty eyes, and then he was not able to move on. But there was no bleeding findings. He returned to the pitch 7 days later. When we had a head injury in the pitch, we have some algorithm to evaluate. SCAT-6 Sport Concussion Assessment Tool is done. There is a concussion group. They gather together every 3-5 years, And based on the recent data, they revise this scat. And there are certain algorithms, and I'm gonna mention them as well. But before that, this important tool has been done by the Turkish Football Federation. It's going to be in use very soon. I'm not going to go into algorithm in detail. It's more relevant to professionals, but when there is head injury, how should we evaluate the player, and in which situations we should take him out for advanced diagnostics? We should look into the red flags first. But if we don't have any findings about the red flags, we have 7, 8 parameters here. They are staged like that, and if we have any suspicious finding, we regard the player as a suspicious concussion, and we took the player out. These are the red flags, and these are the stages. We have detailed information here. This increased awareness has published a consensus that would help us have an idea watching the video. If you have these findings, it is highly likely that you're looking at a concussion, they say. And we have other branches like rugby, for example, not just soccer. And FIFA adapted them to the football, and they have 6 red, 6 yellow flags. So this is a new classification. Accordingly, if there is 1 red flag, it's highly likely that the player has concussion and we should take him out. The yellow flag is that the player should be evaluated by the medical team. And using them, we have done more than 10 studies, part of them with FIFA team. I can send you if you want. And the latest consensus is suggesting certain things for return. Concussion does not have a specific treatment. It is basically we move on with the exclusion of comorbidities like a bone fracture or something like that. And then a 2022 publication on the screen had recommended a longer rest, 3, 5, 7 days. But according to the latest one, bed rest is kept at a minimum. This is a suggestion. And in this shortest time, physical activity should be returned with at least increase in the symptoms. Once we don't have a problem here, by the way, this is 6-stage treatment. To move on from one stage to another, we need 1 day at least. So even if everything is perfect, a concussion player is going to be back on the pitch earliest in 7 days. Premier League is very strict about that. Since 2022, they took the suspected concussion cases to the protocol. In the second stage, we have some aerobic exercises to a certain level. So some things like cycling or running are recommended. Another rule here is that the symptoms should increase 3 out of 10 maximum, and we can do individual trainings and some ball drills as well, but hitting the ball with the head is not recommending. There's a line between the first 3 stages and the second 3 stages. The first 3 stages are pertinent to the light injuries, but to move on with the 4th stage, the player should be symptom-free. Let's say if a symptom shows up after that, we go back to the previous stage, so it gets longer. So in the 4th stage, the team training is possible without hitting with the head, and then contact is not required. In the 5th and in the 6th, there is a full return to the competition. So the staged treatment here is a 1 day at least for one stage. So in the best case scenario, the player is going to be back in the pitch in 7 days. Let's say there is a head injury. If we see an increased injury risk, the first 1 month is an important window. Um, Another injury is 2.5 times likelier. Concussion is 3.7 times, and in lower extremities, injury risk is 1.6 times increased. And then postural control and some patterns could show degradation. Repeated concussion would have severe symptoms, and it takes longer to heal. If there's a repeated concussion, we could have the risk of neurodegenerative diseases, especially in the boxers. Other than that, I don't have much else to say, but most of you are studying in the medical faculties of Turkish schools. Let me give you good news. I started 2.5 years ago at Cerrahpaşa Medical School. With the contribution of our professor here, we're going to hire assistants for the specialty examination in April. That would be the good news that I have for you. Thank you very much for this beautiful presentation. Do you have any question about the presentation? There's one here. Hello. As you know, in the head injuries, and the teams are given one more change ride, and the teams could abuse this situation, exploit this situation. Have you ever seen anything like that? During the COVID, each player had 3 rights to change players, and after COVID, it is 5. And recently, a concussion protocol started. There's a fine line here, of course, about the exploitation of the concussion change. If they're using the concussion change, they are declaring it officially, and that player cannot be in the competition for 7 days at least. So the next game is highly unlikely for that player. So we basically scan the data from the 10 largest leagues of the world. Concussion reports in Turkey they're much lower in number compared to Italy and Germany, for example. So we are in communication with the Football Federation on that. So the decision on whether the player could continue with the match is given by the team doctor. But once you declare a concussion, the player is out for 7 days. Any other from the room? There's one here. Thank you very much for the presentation, Professor. Recently, Serdar Dursun had an injury from Kocaelispor. That was a cut in his head about 10 centimeters, and he wanted to continue. Is that the right thing to do? What do you think? Well, I had photos, visuals of that incident actually. I didn't just show it to you. I can't say much about that without clinical evaluation, but my field experience basically says that, the skin, head skin, when it has a lot of hair, it bleeds a lot. So sometimes it's difficult to stop the bleeding. So the injury is mostly vertical, but it was a big injury. Maybe it could have been stopped. Some factors prevented that from happening. I understand that the footballer, the player, was not concussed. He didn't have concussion, and this is basically a yellow flag, and a medical examination is required with a yellow flag. So the team doctor and health professionals, their evaluation is what matters. Thank you. There's One more question there. I didn't understand the difference between the yellow flag and red flag. What changes in procedural terms? Well, we have some details there. The red flag findings are more relevant to concussion. The yellow flags are more subjective. There's, for example, immobile lie. I mean, when sometimes players just lie down in immobile manner because they're concussed. They had concussion, but some players just don't move for some other reasons. So this is basically a gray zone, and then the yellow flags cover this gray zone. There's, I didn't see, apologies. Hello. I'm an assistant from Chapo Medical School Sports Medicine Department. So there's a thing that got my attention. Sometimes the referees do not stop the game in time, and in the pitch you said we have 3 minutes, and they basically push us to increase the attention of the referees. Can we do anything additional? This is first question. And the second question is that FIFA and UEFA are giving tablets to the teams. So Turkish Football Federation, is it planning to do something like that? Not every team has this capability. Well, about the referees, as FIFA knows very well, they know how to manage this situation, the process. I can't say anything more specific than that, but they can do some things different from what is recommended. Health is of priority here. So about the head traumas, yes, they're trying. Sometimes they extend the 3 minutes time in the pitch. I have not seen any serious problem about that if they let us use more time if it is something serious. The second question is that the video analysis is extremely popular in the last 3 years. Injury studies started in 2005, but they're very popular in the last 3 years. And since 2024, FIFA, in its own practices, for example, U20 Women World Cup, FIFA Futsal World Cup, they give 3 rights to objection to the coaches. The teams are using these rights to object to the decision of the referees. So there's a willingness on using them. So we have a serious documentation on that. We're working on that. Let me give you some rough findings. Demands, we have 2 demands for every match, and 85% of them maintain with the initial decision. So this is data that was obtained from 350 VAR practice. FIFA has Injury Spotter program, was started in 2023, and important tournaments, they're being followed by a physiotherapist or a doctor based on the codification of the red and yellow flags. There's also blue flag, by the way. If it is not something serious, it is blue flag. So they basically work on how accurate the findings are. So they're using video analysis more. But the demands in the pitch, they just want to take advantage of that. All right, thank you very much. And with that, we adjourn the session. To give the plaque to Dr. Yavuz, I would like to invite someone from the organization committee. Thank you very much, Professor, for this beautiful presentation, and I'd like to invite İlke Ülper to give the plaque. Şimdi 10 dakikalık bir aramız var.
dear students, our colleagues, our dear professors. We are so happy to be here. Our title is The Team Behind the Team. During our conferences, sports medicine related panels and meetings are really important. Like conference, like room is really full. We hope that it will be enlightening you in the future for your dreams. I have very valuable colleagues with me. Dr. Osman İlhan from Fenerbahçe, Dr. Gökhan Özkan from Trabzonspor. During their busy life, we are glad them to be here. We planned this with a speech that I will be holding related to the title that you see here. Then we will be having an interactive conversational speech with our doctors here while we are sharing our anecdotes from our daily lives. If you have any questions, we are glad to answer them. At the beginning of our speech, like we have a student body that helped us really a lot, and our Congress president is working with a great team. With our Congress president and our summit and our friends who summit, and we would like to present a small gift for our association, from our association. I'd like to mention a few things about myself, which I don't like that much, but I graduated from Ege University from 1993. Then I was in the United States, and I continued my academic career later until like I got the professorship in 2013. I was in the Turkey Rowing Federation. Then I changed it to the Football Federation of Turkey. Like I worked between different ranges, like from young athletes to national football team, and I was representing the health head of the regional management. Then I worked in Izmir Basketball Club, Altay Sport Club. In their main branch was volleyball and sailing. Then since 2009, I still continue to be Turkey Sports Medicine Association chairman role, and I follow region health region president of Turkey Football Federation from 2018, and I continue to be in the role of a member for the International Sports Medicine Federation, and so on. Of course, I was an athlete, and it started with my athleticism past. First, I started to be in the amateur level. Then I turned in to be a president in my field, so I started from very young. Well, back to our topic, team doctor. Who is this? Of course, the related license and certification needs to be held by this doctor. What's the responsibility of this doctor? From every age and every stage of sportsmanship, we need to secure their health. The muscle and skeleton system injuries need to be cared of, and the doctor must have the related information regarding this problems. So the team leader must be here, the team doctor and medical doctor. So there must be a good medical staff working with the other medical healthcare personnel and sharing their experience and expertise with the team. We shouldn't forget that as the doctors, our future colleagues, our patients are always everyday individuals. But when you are working with the clubs, working with the federation, then your hospital is actually the field itself. So hierarchically, we are not the one who is telling the last word. So our responsibility that we obtain has different dynamics. So we will open this up, and in this dynamics, we are not following this dynamic fully because we don't need to do that. We have a very different work area as a doctors. Of course, this health organization that I mentioned, all health professionals that I mentioned are carrying the leadership in this area. So having the accordingly having the education and developing themselves must be needed, and the communication information like connection with media. These fields are important to be trained as well. So what are the duties and responsibilities? This part is a bit long, but the sports injuries and other health problems are important because in order to get the precocious efforts, it is important to treat them, and then sustaining the related sports rules and play rules in the field must be important, and we need to coordinate the health tests and assessments regarding the athletes, and we need to establish and understand the factors of injuries for the sportsmen. For the training and play, we need to be prepared accordingly. And additionally, treating the players in the field is an important part of it, even like during their turn to the play or during the play, making decisions is important. Additionally, sports injuries and other health problems need to be assessed, and also rehabilitation and coordination of this rehabilitation is important. When returning to the sports part, recurrence risk needs to be decreased, and in order accordingly there must be some implementation regarding that. Also, in order to create the sportsman health network, the members who are obtaining this network and the duties regarding this job needs to be assessed, and also in order to coordinate the medical work, care, and administrative parts, we need to create a schedule accordingly, and nutrition, condition, ergogenic help, regeneration methods, and psychological consultation are the ones who are affecting performance. So in order to, for example, like we had a beautiful presentation from Rüştü Hoca, for example, substance usage and doping use needs to be studied within this body, and also medical decisions need to be ethically assessed. The position, role of the team doctor, to be the part of the team is really important. For example, when there is no issue during the play, doctor's absence is not something that you really feel. But if there is a sudden health problem, doctor's availability will become really important. Having a successful process management and also respectable behavior is expected. So the team doctor carries the representation and needs to feel themselves within the team. When they don't do their profession, even they have to move together. For example, when I was working with a team, I was carrying the water. For example, I was giving my jacket to the sportsman who is cold, and you create a warm environment and connection, and it provides a good help for your communication. Communication channels must be open, and you have to move with the team to be accessed. Like, we cannot close our phones except the flights. For example, sometimes they want to reach their team doctor regarding health problems, or just for any kind of consultation, or just to talk. For example, if even we don't have any shift, we are working without being in the shift. And appropriate behavior and clothes are important. Behavior and approach needs to be professional. Of course, you cannot understand everyone, but at the minimum level, you need to be genuine and socially having the communication skills. So if there is an lack of information, you need to seek for the correct answer. There can be a problem, a sickness that you don't know, and you need to read and you have to think about it. So understanding the problem treatment is with the study, and it creates the normal procedure. Of course, there needs to be a professional and holistic approach with the coaches, and a good team doctor, a good entrepreneur needs to protect the team doctor, and there must be an open and direct communication. For example, sometimes the administrative part will write their communication in a written format, but you need to tell what you think. So there must be an open environment to stay in a good communication. Team policies and interpersonal relation management can be a bit risky. So sportsmen and making comments regarding the sportsmen and coaches is not a good behavior. there must be a proximity in the relationships, and also it must be settled. You have to be positive and having, if there is a limited time and high stress, we need to get the positive energy. There's everyone. Of course, we have some obligations regarding medical parts, but we need to be in coordination with the team and other staff members. Like the team behind the team, I mentioned the leader of the team, the medical staff, and also physiotherapists, masseurs, dietitians, sports psychologists, and other psychologists, other professionals are actually creating this team behind the team, and it can be developed. There is a common goal. Given the right treatment for the sportsman, there is an umbrella model that we can talk about in order to improve the performance, and also in order to prevent the injuries, diagnose them, and given the right treatment. These are helping in order to administratively, efficiently having their position. So the leadership skills are really important for the team doctors. For example, who is the leader? There must be a great vision that leader has a great vision and makes them believe regarding this vision. So how can we proceed with leadership? We don't have such kind of education in our curriculum for the medical training, so we don't have any detailed work after that, but there can be some courses. For example, in 2019, there's a course program called Advanced Team Physician, and there were some leadership courses. Of course, all leadership courses for in any field are included. First one is the communication skill, and the second one is understanding the needs of the sportsman and the environment, and also having an open conversation. Positive leadership affects the sportsman in a good way, and also there can be an ethical motivation behind the leadership model. The main thing that we can focus is focusing on the sportsman as the team players and team staff members as the main goal. So these skills are related to the five important things. For example, we talked about the emotional intelligence. Emotional intelligence is something that you understand the other people's emotions, and you use this skill as someone who can give a consultation and also lead someone to behave nicely. And being honest and working sacrificing can be a good thing. That, for example, pressure in the sports, sexual harassment, or doping issues may arise. In this case, you have to be honest and share information correctly. A lot of team members, they don't check the time duration that they help for. Their main goal is to sustain this effective model. And the other important thing is an effective communication. Doctor needs to expand the critical view. In order to earn the trust of the sportsman, not as a part of the team, but as an individual, you make them feel that they are important and they are believing in that. So being accessible is important, and also open communication. For example, getting back from holidays, and also you have to respectful towards the sportsman. Sportsmen's athletes, their own. They have to have their own individuality on their body and on their decision. We need to give advice to sportsmen regarding the common decision making. Of course, communication is really important among sportsmen, coaches, conditioners, family, and administrative residents. Of course, within the young and adolescent sportsmen's decision-making mechanisms need to be within the families. Of course, they are having the open communication because they are together with them always, with their physical and mental health. So, with the help of their monitoring, we need to get benefit from their point of view. Of course, open communication within the team is important. The team giving the trust for the whole team. Of course, the monitoring and assessment of the whole team is important. The other, for example, there are some priorities for the sportsman's health, and you have to prevent from some risks. For example, you check some health issues of a sportsman, and as a doctor, for the player, for example, there's a decision-making moment by the medical doctor, so you have to work in order to sustain the decision. For example, these decision-maker sessions are really complex and are affected by the many factors. Of course, there can be some profit differences. For example, in the United States, there is a different, like NCAA is an important part. For example, in Duke University, team Dr. Frank Bassett has a statement, and when we assess their ideas, we have to think about the team's building process. For example, in order to choose the correct team members as a doctor, you have to work within the common mission and choose the correct team members. Being crowded is not a good thing. Of course, there are 4 main important details: communication, coordination. For example, coordination tries to assess other members' skills, qualities, and experiences and getting benefit from it. Good features and positive group dynamics need to be supported. Every team player has their own goal and responsibilities, and these need to be defined, and all team members need to be learning their own role and having the responsibility. During the process, there can be some flows. All mission and priorities need to be repeated and remembered. So we are in the last part. The team doctor needs to be open to alternative ideas and approaches based on the respect. Open and effective communication makes everything easier. Having the consensus in every decision is not easy, so as a team doctor, you may need to take initiatives. For every team member, they need to respect this decision-making structure. The continuation of the team is important for the success. Of course, this positively affects the relation between sportsmen, entrepreneurs, and administrative management. Appreciation creates a positive environment. This can be something tangible and intangible. Team leader needs to hire new members for the team as well and try to work on the alternatives if necessary. So this is my speech for now. Thank you for listening. So far, do you have any question regarding things that you listened to or any contribution? Everyone understood really well. Thank you so much. Now we continue our session with my dear colleagues, Dr. Osman and Gökhan. For the basis of the team, doctors like sports medicine, we will try to have a conversation. My colleagues mentioned about themselves. I would like to mention about Dr. Gökhan Özhan graduated from Ege University in 2002. They worked in district doctor in Kütahya, and later he finished his academic journey in
And since the beginning of the season, he's acting as the doctor of Trabzonspor. I congratulate him and would like to welcome him. Dr. Osman graduated from Akdeniz University's medical faculty in 2013 and at sports medicine here at Uludağ University. He has completed his specialist training and he started working as an observer in Munich, Germany, and he started his team doctor career in Bursaspor basketball team, and at Manisaspor and football club of Manisa he worked as a club doctor. He worked with the youth national team, and in Izmir he was the team doctor of Göztepeспor, and since 2022 he has been acting as Fenerbahçe's doctor. I'd like to welcome him. Now, in this part of the session, I'd like to give the floor to Dr. Özsan from Trabzonspor. Thank you, Dr. Metin. It's great to be with you here, and it has a special meaning for me.
If you remember or not, I remember, but if you can talk about it, it would be nice. Like, I was working as a practitioner doctor when I was working in the youth and cities health center. For example, I graduated from, like, I didn't find a chance to experience their work directly. I didn't know how the team doctor could work. Like, you would become like a specialist at that time, if I remember correctly, and as the assistant for the medicine, for sports medicine, I was really curious about it. I was working as a team doctor, but I wanted to do professional. I attended TUS exam, and when there was an available position, I started my work in Istanbul. Our students here, most highly students are here. This sports medicine field of Uludağ University is really important for Dr. Hakan Gül. He was working with the federation, our Ufuk Hoca, and they had good relations with the teams positively. When I was an assistant between 2009 and 2010 in Bursa team, I worked as a doctor. Now I started my own career as an individual career, and I was not working far away from this field. We met in Muğla, right? No, I think in Gölbaşı, but in Muğla we met before, and we were in Marmaris camp, and in Muğla we were in a match. I was working in sports management. So from so far, we have a lot of experiences with each other. For my career, if we could give any insight to you, I would be really appreciate this thing. Of course, for the friends that we have here, we would love to touch someone's lives with your help. So in order to carry this from the past to the future, we need to deliver this to the future. I would like to give the word to Dr. Osman İlhan, and also I would like to give word to Bedrettin Hoca. Dear Osman, word is yours. Thank you so much. First of all, I would like to thank my dear colleagues and you here for having us today. I am so happy to be in Uludağ University again. I would like to have a question to the hall here. Have you ever heard about sports medicine or team doctors before? Can you raise your hands? Yes, there is plenty of people who are having. You have the chance, because when I had TUS exam, I thought about working as an orthoped. I wanted to work for orthopedics, but a friend of mine told me that there is a specific branch that I can do in the sports sector. When I was choosing, also I love Fenerbahçe team. Maybe I can be a team doctor for Fenerbahçe, I had this wish in my head. I'm so happy to be here. And many people from Uludağ University know sports medicine as a field. Everyone thinks that you are taking care of athletes, sportsmen, but this sports medicine field is really widely big topic. For example, when, for example, the truck driver snatched the crossbody bag as a problem, as an injury, we were helping. So we are not only helping the sports, but we have other like who are thinking for the sports medicine field after graduation. Maybe this can be a good talk for you. So thank you so much. Who thinks to study sports medicine in TUS exam? I will give you a word. No worries, I cannot hear you. In spring, we had this student congress in Kuşadası, and we had different professors from different fields. They also invited me to the congress. It was really crowded. They said, you decide the topic. For example, I was thinking about the topic. What would I explain? So I thought about sports medicine. In TUS, past TUS exam, sports medicine was one of the top fields to be chosen. So I realized that this was important and I suggested. Metin Hoca, the word is yours. Thank you so much. Gökhan, which sports team are you from? Bursaspor hocam. I'm from Bursa, so I learned football in Bursa. Of course, everyone's choice for sports medicine is an important event. For example, Necati Hoca influenced me. I didn't work with him before, but he's one of the biggest important professors. For example, in TRT channel in 1991, he was talking about some things, and I checked the program. I liked doing sports. I didn't want to study medicine. My family wanted me to pursue medicine program. Then I saw that sports medicine was related to engineering, and because of that, I chose sports medicine because it was familiar with engineering. So someone from Bursaspor, someone from Fenerbahçe. I support Galatasaray, by the way. I couldn't. Metin Hoca, I'm looking at you. Like one of you is in Trabzonspor, the other one is in Fenerbahçe. So when this is the thing, like we would like to write some things like. For example, getting 10% of the training fee from the training here. You summarized it very well. The thing that I like in medicine, sports medicine, during my assistantship, our professors, for example, our field is really broad. And when I was an assistant, we had some chances to be attended in the clubs. You would go there in teams and work with the athletes. So this is how it started, and our professors helped us. So this is how I got into this field. Necati, Dr. Necati, Dr. Fikret. He is also working under sports medicine, and also he is a referee. So using this field in football is really appealing. So when we talk with clubs, every assistant needs to be sent to a sports club. So in Bursa, it went like that. Such beautiful institution, such things are important for our future generation. Of course, we would like to be adding some words. It improves it makes us seen for the sports medicine field, and we are being known by the people, and also it is close to the model which we have in Europe. For example, there are other doctors in other fields that were working in sports medicine. Right now, sports medicine will be an important field in the future for the job opportunities. I said some random things that I would mention, but I would like to give a few anecdotes regarding the topic. Gökhan, I care about this. I don't want to be seen like I mentioned a few things that you know already, but I care about the most that can you tell something like I cared about this the most? So the things that you mentioned are important that a team, as doctor that owns in the sports team. So you need to expand your, for example, if there are many expectations that are asked from you, maybe you can work on them. But if there are many changes in the environment, some players are having the pressure, or or sport coaches. These are international people and having earning important amount of money, and they are important. So you need to listen to them. As you said, we are working for the team, and in the team you need to make decisions in the work field, and also hiring people, connections, and with media, connections with the management. You need to get the skill set by the time with experience. I was a practitioner. I was working the team doctor as the field doctor, but we were not realizing the importance. We were just there, staying. As much details you learn, your stress level goes up. Our field is really developing when you consider someone who is practicing gynecology. Maybe some developments are made more in sports medicine field, and you start to learn some things lately. For example, when we give hamstring injuries, we would just classify them first type, second type, and third type. And for every anatomic importance, there are some really important serious injuries and horrendous injuries. Sometimes the athlete can go back to the pitch easily, sometimes not, and explaining the causes and the process to the team leaders is important, and being leader is important in this part. So what would you care about the most? I would sorry, I didn't give you any answer for your question. I would say communication and trust with the player, with entrepreneur, coach. The communication you have is important. You have to convince the player in order to get their trust. Every injury is a kind of test in this sense. So the expertise in your field is not that important when there is a sudden risk. Every player who are having, there are some players who are really successful and important players. Every time when they have an injury, they experience something important, and they're always in touch with their doctors and physiotherapists. Your assessment is if it's really different, and if you are not right, then you lose the trust on you. So it is a kind something that the team owns as well. The correct things you make are forgotten really easily, but the mistakes that you have are forgotten really, really hard. The communication is really important. Sometimes there is a really important match when you say that the player will be ready in 3 weeks, but the match will be in 3 weeks. In this time, sometimes athletes want to take the for example, for head traumas, you don't want player to go back to the pitch. But if player wants to take the risk, or if the coach says, I want to take the risk, you need to sustain the treatment and work accordingly. The risk management will be important in this regard. So these are the things that I can mention. One is different. For example, I care about the documentation. It's important for me. I would write the date, time of the examination every day. Of course, we have the files, but even I write the phone call in the files as a report. On that day, on that time in the phone call, I gave this medication, I suggested this pill, drug, etc. And of course, people are really sensitive about this issue, but just to secure, for example, there is a problem with a legal problem. Of course, they are important. I can say that I'm a lazy person regarding these records. Of course, I keep records from my daily notes, but it can be changing every day. As Osman said, we are in a group working like in a family environment with 50 to 60 people. You are traveling together, going for the games, you are happy together, you are sad together. And in this journey, if you have a contribution, you are happy. So trust is really important. And having the trust between the team. As a team doctor, I would not work in a work environment that I'm not trusted, so I would reconsider as a time of change. Sometimes clubs want to work with some people that wanted to trust you, and sometimes they wanted to give you an available time in order to trust, but if it doesn't suit you, then they leave the job. It's an interchanging environment. If you have a goal to work in sports medicine as a team doctor, this area is open for some adventures. The people who are working only for the money behind it, for example, they can earn really good money in a short time, but for example, some Anatolian clubs, the payment can be postponed maybe. and sometimes for some works I couldn't get paid immediately and it takes time. But even though for these problems, we try to enhance the sports medicine field within the clubs, with the clubs. And as someone who would like to who would love travel, adventure, and working under pressure, you would work under team doctor position. But if you want to be an academic, of course, the things are changing. Trust within the team and the trust that I feel towards them is important. And I would like to mention this as an important point. Thanks so much. I also think that it's a very important point. I will come to this point. I know that the time is passing. Building the team is important. I tell my colleagues like the number of the people working in the team and stuff. And I was in a camp in Riva, European Youth Football Championship. And Riva is a far village in Istanbul. There was a masseur, me, and there was someone. Like I asked for a physiotherapist. There was no physiotherapist. There was only masseur, and I said we need someone who is physiotherapist. They said we only have physiotherapists in national football team, and a professor from Istanbul Medical School, Florence Nightingale Hospital, Professor Vahit. In Riva, I went to to see the professor in Florence Nightingale Hospital. If they say yes, if the health management say yes, the doctor will come. So this time, the dietitian even is involved in the team, but at that time we didn't have such help. And I explained the situation to him. I was on my way for 2 hours. We need a physiotherapist. He said, Metin, I understand you, but what does a physiotherapist do? And I explained the work behind it, and he said, it's a good thing. You can get benefit from it. And immediately, the day after, we received the physiotherapist. And we say this thing as a team building. So I would like to ask about the people, numbers, and then we can have the Q&A session. In Trabzonspor, we have 4 physiotherapists. Our female team, A team, and also basketball team. We have some other sub-teams. They are all having their own medical staff. Like some of the numbers are not that high, but I hope it will be developed in the future years. I'm working as a team doctor. I work in the there's someone working in the emergency with me for the hospital visits. We have 4 physiotherapists. They are specializing in sports physiotherapy, and sports physiotherapy is a field that you need to specialize. There are 3 masseurs. It's an important thing for the team players. They help for the other details during the work. We have dietitians, nutritionists, and there is an academic performance coach. And in order to go back to the pitch, they help us within the field. This is our A national football team. And in Fenerbahçe, we are working as 2 doctors. We have 4 physiotherapists. They are working for a long time in the club. They are specializing in leg injuries as well. We have 4 masseurs, and they are in the club, sports club. Like they already know everything about the sports players. They know everything about it, and they are always staying with them. Sometimes during the massage, if there's a very stiff part, they tell us about some muscle problems, and they are helping us in this regard. We also have a nutritionist and rehabilitation entrepreneurs. When we go back to the pitch, for the trainings in the pitch, they help us, and also for the other fields in for example, in football infrastructure, we have a team, and also in basketball team. In volleyball, we have a team as a separate doctor. Main branches have their own doctors, and in amateur field as well, we have doctors and physiotherapists. And it means to be the pitch doctor is a different thing, team doctor is a different thing, and club doctor is a different thing, right? Yes, they're all different fields. If there are professional competition players, there are important doctors as well. Of course, sometimes we make this kind of mistakes. Sometimes they sign the agreement regarding general doctor, but as if we are signing a club doctor. But sometimes all infrastructure doctors are connected to club doctors too, and it is a kind of mistake that we see sometimes. We can have some short questions from your side. There is a student that we receive. We would like to announce that we need to be careful about the questions that we are asking. You can ask any question that you have. Hello, I'm married. I study medicine in Uludağ University. I have a question to Osman Hoca. Shumansky and Kerem are injured. Can they show up on tomorrow's match? And my other question, Don Duran, how much he will play in Galatasaray match? This is my other question. Thank you so much. Of course, I said you could ask all questions, but we cannot answer them all. The question that you said, Kerem having the trainings, Shumansky, the national team doctor, said there is a muscle injury, so he cannot be quickly recovered immediately. So for John, we cannot say something for him. Thank you so much. And there is a political answer from your side. It's nice. You need to know the line. Hello, the question that I want to ask. How do you define the active day of yours? What do you do in your daily life? I would like to specify the things. For example, the team doctor needs to be very cautious about privacy. Privacy is important for the doctors and sportsmen, and there are some news in social media. Privacy in social media is important. Some mistaken news, some fake news are made in social media from time to time, and you need to understand the profit of the team, but this is also a part of our job. On a daily basis, in the sports club, our working principles, it's not something like that you start at 8 a.m., work until 5 p.m. It is an interchanging process according to your travel plan. Every week there is a time given to the sportsmen, players, and they are invited to the club in order to fulfill some goals. Like before the training, 2 hours, 3 hours before